Hi, I'm Dr. Corey Moss at the Moss Clinic, San Francisco. I wanted to take this opportunity to talk a little bit about the Wounded Warrior Project. The Wounded Warrior Project is a program that was started by the American Academy of Facial Plastic and Reconstructive Surgery, our national academy that represents the 3,000 specialists in facial plastic surgery, and is targeted to helping veterans that have scars or other deformities, particularly of the head, neck, and face, that were the result of injuries sustained during the course of their duties for our country. It's very much obviously an honor to take care of these gentlemen and women. Many of these men and women have access to the Veterans Administration or Veterans Affairs hospitals, but there are long waiting lines, and there are sometimes difficulties for them in accessing that in terms of distance and travel. So this is an opportunity for us to give our part, if we can, in helping a lot of these people return to, as best they can, putting their foot forward and face forward back into the working environment after serving our country. The Wounded Warrior Project has been in existence for about 3 years. When we're in our 4th year now, and I wanted to give an example, really, of a really touching story that struck me very profoundly with a patient that was injured in Vietnam. His entire platoon was killed by a grenade that was thrown into their area. And as a result of this explosion, our patient was very fortunate to survive, but had extensive lacerations, cuts, and scarring across his hair-bearing portion of his head at the time. And of course, he's much older now. As he continued to age and lose his hair, these scars became a much more prominent feature on his face, and it actually brought back some form of post-traumatic stress disorder, just really looking at it and bringing back those moments that were so difficult part of his life.
So, Dennis, how are you feeling, my friend?
I'm doing fine.
Nice to see you, and we're going to be working today on further disguising the little scar that big scar that you had on the head. We're going to do our little second stage on improving or disguising the scars you got and your trauma in Vietnam. What year was that again?
That was 67.
1967.
Yeah.
And I know you described
Actually, we all called it 67, 68 during the Tet Offensive.
Oh, okay.
And it actually happened in the first part of 68.
Okay.
The wound that I received from shrapnel from a mortar.
Is a mortar is that something that is launched in the air?
Yes, it's launched through tubes
and your platoon was.
Well, I was actually sleeping outside under a tent.
Uh-huh.
And one of the guys in my outfit woke me up yelling, "Raleigh, Raleigh, get into the bunker."
Uh-huh.
And I stood up and turned around and started running towards the bunker, and was kind of starting to dive into the bunker on an angle, and all of a sudden it flew up about 2-3 feet away from me to the right.
Right.
And knocked me clean back on my back. And all I could remember was a white phosphorus splash that they give off.
Yeah, and then you had a lot of scalp injuries.
I was blinded for a while. And then when we got me stood back up and into the bunker, they turned on a flashlight, and I had blood all running down my face. And there was a lot of shrapnel all through here, kind of going horizontal.
Yeah.
And all my rifle stock and tent and everything else that I was sleeping in was all full of holes. And so we had a tent hospital out there, and they thought they had taken most of the shrapnel out. Out there.
So as you got older then, and you kind of lost your hair,
my hair receded, and it showed. It really showed.
Told me a little bit about how that brought you back those times that were pretty hard times in that era then. Is that right?
Yeah, definitely a lot of flashbacks to that experience. and a lot of memories and flashbacks to it. And I just did not like the look of that big scar. Some people actually came up to me, asked me if I had had, like brain surgery or something.
Right.
Yeah, because
So far we've done a single session, and
Yeah, it's
really
really
it's
great.
it's
Yeah.
hard to see them
Yeah.
even now. I mean, we've got this area marked out now where we're going to do some more grafts to disguise, and we can get some more in between, and so hopefully we can get you to where it's
right now
it's
it's
a memory that you're only going to get when you look in your
Yeah.
photo album.
right now it's very livable in my mind,
Good.
and I'm very pleased with it. And I'm sure it's going to be better with adding a few more hairs up there.
Absolutely.
And,
All right.
yeah.
Well, good.
Yeah. Now when I look in the mirror, I don't focus on that scar.
Good.
It's something that's slowly fading out of my psyche.
Right.
Before, whenever I look at myself, it was right there and kind of bothered me every time.
Right.
Now it's actually, not
Yeah.
thinking about that much.
Yeah, good. Well, I'm glad to hear that. And we can probably zoom a little bit, and we can kind of show his, he can kind of lean down, but we've got this marked for his hair session today. We're going to take Dennis, and we have kind of marked an area in his central and mid scalp here over the scars in particular. We'll probably extend this marked area. We've measured the square centimeters back to do his frontal forelock is the main target area here that we want to get. That's really the important thing. The frontal forelock is key in terms of hairstyling. You can go back with the hair, you can part it on the side. His temporal area actually looks pretty good, so we probably will, while we've marked that, that's where extra grafts would go, but the primary focus here is in the central frontal forelock area. And then we'll get him going. He's already getting a little sleepy. We gave him some happy medicine here. So we'll get him going, and that'll be next steps.
What we offered him was the chance to improve the scars by simply using hair grafts, which I do quite a bit of. Hair grafting is one of the Moss Clinic's areas of specialty. And we do a technique called follicular unit grafting, where we take individual 1, 2, or 3 unit hair unit grafts, just as they grow on your head, and very carefully place them. In his situation, it really was just fairly typical male pattern balding that exposed these rather deep and tortuous types of scars. And by planting hairs around them and allowing him to get his hair growth, we can bring him back to where they're not a daily reminder of a very difficult part of his life. So I think it's an honor and a privilege to be able to serve our veterans by donating services and time, and hopefully the story that this patient can tell, and his history and his photographs will touch you as they have me. If there's any questions that you might have about the Wounded Warrior Project, you're certainly welcome to contact me at info@mossclinic.com or at drmoss.com, or call my office in San Francisco. That's 415-567-7000. I look forward to hearing from all of you and hearing any feedback on the Wounded Warrior Project. Thanks.